and share my screen. I actually have three separate small presentations to do. Just as a little background, I'm going to talk to you on what the Medical Reserve Corps is and its national role, how our Medical Reserve Corps functions here in the state of Vermont, and then drill down into our National Preparedness Month program and how MRC supports that and hopes to continue supporting that through collaboration with the Department of Libraries. So just holler at me when you can see the presentation.
We can
I'll
see
get
it.
rolling. Awesome. So just as a disclaimer, this is actually a presentation that was put out by our national program, not one created by me, but again, happy to answer any questions either throughout the presentation or at the end, if you have something that you see on one of the slides and need some more explanation on. So basically, the Medical Reserve Program is something that was developed as a result of the September 11th terrorist attacks. What we found is that there were a lot of spontaneous volunteers that were deploying to areas of need. A lot of them had vast medical or public health knowledge that they wanted to put into practice. But like most spontaneous emerging volunteers that are unaffiliated, they didn't know the best way in which to help. They were sometimes putting themselves in harm's way or getting in the way of those, official response agencies that were on the scene. So the concept came out in 2002 in the aftermath and the lessons learned that we wanted to establish a program where we could background check, vet, train folks with this kind of knowledge to be responders in the case of disaster. So back from 2002, when this program was piloted, all the way up until today, we have become a national network of volunteers, and we have a focus on information and education related to public health preparedness during those blue skies times. And then in times of any disaster, whether it's local, state, or federal, we fold into community partner agencies and responders in order to be a force multiplier and help in disasters. So curious fact is that there were 6 pilot programs in the United States before this program was established nationally, and our Southwest MRC based out of Bennington was one of those 6 pilot programs. So Vermont has been in this since the very beginning. Right now, our program boasts over 200,000 volunteers. I think it's actually closer to 300,000 at this point as a result of the pandemic. And there are over 800 MRC units in all 50 states and territories. So again, this is just a little bit more about the National MRC mission. We do engagement in our local communities. We work both with organizations such as libraries and businesses, assisted care facilities, you name it. We also host events for individuals that are interested in learning more about personal preparedness or an aspect thereof, with the goal of improving public health and health in the region, and also making sure that we are developing resilient communities. Some MRC units are very heavily medical focused, and some are not as much. If you look at MRCs throughout the country, you'll see some focus very much on nutrition education, some focus on veterinary response. We have one of the more traditional MRC styles here in Vermont, where we have about 60% non-medical, 40% medical folks. Really, we do tend to stick to the human health side of things, but just like any emergency, there is always going to be crossover where we're talking protection of pets, protection of property, things along those lines. The MRC obviously benefits the community in many ways. We help connect organizations to each other and to the larger support structure. We do have that force multiplier effect where we can be extra bodies and preferably trained bodies that are familiar with working with these organizations because we do engage with them on the regular. And it helps the community because they have a way to feel involved. There's nothing worse than being a survivor and living in a community overcome by an emergency and wanting to help and not really know how. So we provide an outlet to be able to train folks and get them involved so that they feel like they're giving back to their community. So this is just a map of where in the US our MRCs are, and you will notice that a lot of the MRCs really kind of lie in that place where the disasters are. You'll see they follow the coasts, so then, you see flooding events and blizzards and hurricanes and things like that on the East Coast. On the West Coast, you're going to have, teams that are more familiar with things like earthquake response and heat emergencies. And again, Midwest, you've got the tornadoes and things like that. Um, we are obviously not the only national organization out there that deals with this kind of thing. We'll talk a little bit more later about things like community emergency response teams or CERT teams or other specialized groups. But we really are the main one that has a public health and medical focus other than American Red Cross, which again is an international agency.
Heather, if you're speaking right now, we can't hear you. You may have muted yourself accidentally.
Can you hear me now?
Yes, thank you.
Okay. I have no idea how that happened. So thank you for pointing that out. So again, as I was saying, our MRC in Vermont falls within Region 1 of the Department of Health and Human Services map. Region 1 consists of all 6 New England states, and we boast one of the highest complements of MRC units and numbers of volunteers in the country. We do mainly work as a region, but occasionally we do collaborate with those regions outside of our area.
It just happened again. You're muted.
I don't know why it's doing that. It's muting every time I hit the advance button. So I'm not quite sure what's going on there. But again, this chart just indicates the number and types of volunteers that we have nationwide. You will see that even though we have Medical Reserve Corps in our title, a lot of our folks are not medical. All we ask of our folks is that they have first aid and CPR level of knowledge, that they take basic trainings like, HIPAA compliance and bloodborne pathogens so that they can work safely in an emergency environment. But again, those folks are essential for things like, educating, registering folks for clinics, just being hands on deck as support staff. And they bring a lot of different skills to bear. We have folks who are accountants and engineers and translators and pastors and many different skill sets that fall into this type of environment that are very beneficial. The rest are all either health or allied health folks, and we probably have up to 30 different areas of skill, everything from respiratory to phlebotomy to social workers and counselors and MDs and APRNs and you name it, it's there. So again, very varied group of folks. And the one thing that brings us together really is just our desire to promote health in the community. All right, so these are the kind of things that we tend to really focus on, and you will see that natural disasters and infectious diseases, such as the COVID pandemic, are really our bread and butter. There are many other components of emergency preparedness, as you probably all know. So it's often that there will be crossover into some of these other types of events as well. So just to highlight a little bit about the past 3 years, because I think it's very difficult to ignore. We had over 1 million volunteers provide, or I should say, 1 million volunteer hours of service provided by our volunteers during the pandemic. Here in Vermont, most of our response was related to testing and vaccination, 211 call center support. We had an MRC team that did the packaging and shipping up at our medical countermeasures warehouse, which is the national warehouse that supports our communities with federal stockpiles of things like, drugs and gloves and personal protective equipment and so on and so forth. Many different communities use their volunteers in different ways, such as epidemiology and surveillance through contact tracing, supplemental workforce to our nursing homes and our hospitals that were having staffing shortages. So there's a variety of ways that MRC met the need, but we did see our ranks grow almost double as a result of the pandemic. And we're in this interesting limbo world right now where we have those folks that have been go, 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 go for their entire time with the MRC, and those folks that are really glad and excited to get back to their information tabling and their more, casual engagement with the community. So we're trying to find our niche, and I'm really hoping that National Preparedness Month will be one of those niches that we can fill easily. I just want to jump over this slide pretty quickly, but this is different examples of ways that MRCs around the country have been involved. And again, we've done hepatitis A clinics, we've done winter weather events. We staffed 4 shelters just in this past year in response to the extreme cold events and the winter storm events over the Christmas holiday. So again, a lot of these will fall into our purview as well here in Vermont. All of these are resources that you can use to get more information. This presentation came off of the MRC website for the national program. MRC Train is one of those databases that our volunteers use to take training courses. But again, they have a CDC train that's very similar to our MRC train that has free information on preparedness that we recommend that you avail yourself of if you want to learn more on a certain topic. MRC has a Facebook and a Twitter page. So again, we are pretty receptive to social media outreach. All right, and that's it for the national presentation. I only wanted to highlight a segment of our statewide presentation because I think the national one did a phenomenal job of covering who we are and what we do. So again, this is something that just shows where the Medical Reserve Corps falls in our national programs. We fall under the Administration of Strategic Preparedness and Response, or ASPR, which is, a federal oversight agency. A lot of these other programs that are national in nature, like CERT or Citizen Corps, the Fire Corps, again, also fall under that whole Health and Human Services umbrella. In Vermont, we are one of a number of agencies that are very active in disaster assistance. MRC is the volunteer arm of Vermont Department of Health. So all of our grant funding and supervisory oversight falls under VDH, which is why I personally am both a VDH employee and the statewide coordinator. A number of our MRC unit coordinators, who are the leaders of the individual units, are also emergency preparedness specialists in the health department. But we work alongside Vermont Emergency Management, which has their own volunteer cadre. They have Serve Vermont, which is more of a general assistance volunteer group that can do things like feeding meals in soup kitchens or debris removal. We work aside the AmeriCorps program, which also falls under Vermont Emergency Management, disaster animal response teams, which fall under Agency of Agriculture, and the RACES program, which is the Radio Amateur Civil Emergency Service, which does emergency communications and ham radio staffing. So again, we all work in conjunction with one another. And this is just a little bit more about those organizations that we work alongside here in the state. So this is a map of our MRC units. We have 9 units here in the state. One of them is a bi-state unit, Upper Valley MRC, and they're the only bi-state unit in the entire country. So they were founded in New Hampshire back in, I think, 2009 or not 2010, affiliated with the state of Vermont in 2013, and they have about 135 volunteers, 2/3 of which are Vermonters and 1/3 of which are New Hampshireites, and work on both sides of the border. All of our other units are exclusively Vermont and work in the indicated health districts that you see here. So again, because they're under the health department, the service area for each unit follows either 1 or 2 health districts, depending on the unit's coverage. So this is a picture of some of our awesome unit coordinators. We have, like I said, 9 units, and we actually have 12 coordinators, 13 coordinators. Because some of the units, depending on their size or how many health districts they cover, will have more than one person to share the burden, to handle the administrative oversight. And then, in addition to those that are paid staff through the health department, we do have 3 volunteer leaders that have just donated their time because of their love of MRC, because their area of expertise, and they help our paid leaders do their jobs. So MRC units are, again, pretty structured. We have anywhere between, I think, probably about 53 volunteers in our smallest unit, upwards to about 325, 326 volunteers in our biggest unit. They are the heart of everything that we do. And a lot of our programming depends on their areas of expertise and what they're interested in doing and whether we can fill a gap in our community. The unit coordinators, like I said, are the leadership. So they schedule the meetings, they do the trainings, they're filling the grant coordination and invoicing role. But really, they're kind of the face people of the organization and work alongside community partners such as the libraries to make sure that we're providing appropriate programming. Each unit has a fiscal agent, which is a community partner. It could be EMS, it could be a regional planning commission, it could be a local hospital, community action organization, and they oversee all of the finances and grants for the MRC unit. And then we have advisory boards, which are composed of healthcare and non-healthcare partners in the area, senior volunteers to provide guidance and oversight, and a number of other special interest groups. These are some of the things that we do here in the state of Vermont as far as activities. Like I said, we're very much, event support, response, education, information, in our Blue Skies times. All of our volunteers receive liability and workers' comp so that they can do activities on the regular, whether it's a declared emergency or not. During a declared emergency, obviously, our scope of practice goes up because there are lots of waivers that allow us to jump right in and work wherever we're needed, so long as our folks have the appropriate licensures to do so. Um, and then, in emergencies, points of distribution or pods, as we call them, which are essentially clinics, is our primary focal area. Medical surge, so staff supplementation, outreach, first aid stations are a big one that we do. So if you attend a community fair or a local road race, our MRC folks are usually out there providing first aid support or cooling and misting stations and giving out water to runners or to people attending events. We do preventive health screenings. So you might see us doing foot care clinics for seniors. You might see us doing blood pressure checks at mass feeding sites, things like that. And we are built into the sheltering system. So if you have cooling and heating shelters in your communities, or if Agency of Human Services or American Red Cross sets up a larger shelter, our volunteers will often supplement those. So just some pictures of things that we've done in the last few days, or not few days, few years. All right. And I don't necessarily want to go into becoming a volunteer, but when I talk specifically about the National Preparedness Month activities, one thing I will say is that if libraries are interested in hosting an information night or a new volunteer orientation, we are always excited to recruit from local communities. Because as you saw on the map, some of our MRC units cover a pretty wide service area, and it's all well and good if we have, 150 volunteers in a unit, but if they have to cover 35, 36 towns, then obviously there's not enough folks to go around. So we're always looking for ways to engage locals that want to support their own towns. And they can visit this website, which is our branded landing page that goes to our responder management registration area, and it's oncallforvermont.org. And it gives just a little bit background on how to sign up for the Medical Reserve Corps. If you encounter folks that are also interested in volunteering as an emergency medical technician, this is also the landing page where they would go to learn more about supporting their volunteer community with EMS. All right, this one is short and sweet. I absolutely promise because I don't want to talk your ears off. So this one I put specifically together for today to just highlight some of the things that you've probably already heard in the Department of Library newsletter. I think this is the third year that Medical Reserve Corps has worked alongside libraries to promote National Preparedness Month activities. The previous 2 years were pretty low key, and we're hoping to expand it. Uh, but basically, as a background, National Preparedness Month is a federal program. It was officially launched or coined in 2004. Uh, and you're probably most familiar with it through FEMA's ready.gov website. FEMA runs ready.gov to provide a variety of information on personal preparedness or community preparedness, business preparedness. And it's a phenomenal website that is just chock full of all kinds of resources. Uh, During the month of September, which is National Preparedness Month, they go ahead and put together media toolkits and a specific, I guess you would call it subpage, whatever, of the ready.gov website that highlights certain themes that they run every year, and it changes from year to year. But again, they promote these materials out to all of our states, and most of the states will also follow the national theme as far as their preparedness activities. Um, it's a great opportunity for states and territories to use National Preparedness Month to highlight preparedness education. And when we do it here in the state of Vermont, not only does our communications division come up with their own list of things that are really Vermont specific that we want to focus on and the types of emergencies that we see on the regular, we will also pull some of those national materials. So the focus is first and foremost how individuals or households can become more prepared. Uh, it's very saturated towards social media. So we use Facebook, we use Instagram, we use Twitter to get information out into the hands of the community on basic things. So how to make a home shelter in place kit. Excuse me, shelter in place kit, how to make a home evacuation kit, what to do for roadside safety, checking your smoke detectors at a certain time every year or multiple times a year. So those basic things that sometimes just people understand that they need, but don't really think about 24 hours a day, 12 months out of the year. Um, Sometimes we will use our social media to highlight a certain class, like Stop the Bleed classes for emergency trauma care or a CPR class that's going on in the community. We may offer a class on integrating, you know, access and functional needs into plans, and businesses or municipalities would attend and learn how to make their existing plans more friendly. Uh, So again, it can be any number of things, but the media is kind of the launch pad. And then if there is community interest, we can host a class through the Medical Reserve Corps or through the Health Department office that gives a more of a deep dive into some of these specialized topics. So why collaborating with libraries? To me, it just makes sense because this is the MRC's bread and butter to talk about preparedness, and this is something we are intimately familiar with. But again, all of our speaking and having these activities does no good if we can't find the right audience. And we have found that one of the most successful partnerships is really working with our libraries because you know the pulse of your community. You are a trusted location that works with, your school children, that works with members of the community. Your activities are free. You usually have education rooms. You usually have a vast method of reaching folks, whether it's via newsletter, whether that's, a weekly column in your paper, whether that's your own website. So again, you know how to reach the people that MRC wants to reach, which makes this ideal for us to work together. And the past couple of years, at least my personal experience is that the libraries have been a phenomenal help during the pandemic, giving out information and even serving as host sites for some of the clinics. So this little visual I have is from a flyer from one of the clinics that I was overseeing. We worked with Springfield Public Library to host, I think, upwards of about 8 clinics. And they were some of our best attended events and really reached niche populations that we couldn't by doing the bigger clinics through schools. So people already associate the health department and the MRC with the libraries and a lot of our locations. So we're hoping that we can capitalize on that during National Preparedness Month. So again, these are some things that we could do with libraries. It could be as simple as us sending you a packet of information to create a display. We could do a tabling event in your lobby where we give out information if you wanted a presence of a volunteer for folks to talk about the MRC or to explain things in more depth. Uh, we can provide lists of books or audio visuals or things like that that the libraries can display and give out. Last year, we came up with a book list of about, I think, 20 or 25 adult and child friendly resources. Some of them were fiction about disasters in various forms. Some of them were self-help. Some of them were historical accounts. But again, just things that really highlight the needs of, for preparedness and capitalize on gaining people's interest in the subject. Um, We've had MRC units write educational pieces that can be sent out. We've also had links where the health department likes the library pages and the libraries like the health department pages and share information about National Preparedness Month. So these are all low-hanging fruit, really easy for just about any library to get involved in. Uh, Education is our next step. And again, this requires a little more scheduling, but our unit leaders and our volunteers love coming out to venues and promoting certain topics. Uh, so we have some units that are just very skilled in 2 or 3 types of talks, like warm weather preparedness and how to stay safe from ticks, how to do emergency preparedness planning and kits for your home. We have some units that have much more robust types of things. So they'll talk about, planning and advanced directives. They will talk about how to work with the blind and visually impaired in emergencies. And there's a whole host of different topics that we can come in and chat on. And if we don't have a topic, usually we know the organization in the community that does have the topic that you need. Uh, so we would love to hear from any libraries that have an education room and a desire to fill their calendar with a topic of interest, particularly if you've heard from someone in the community that there is a certain area that they want to know more on. Again, we're also happy to stage any sort of, recruitment and orientation events that would benefit the MRC. So not only can this be National Preparedness Month, which again we highlight for a very specific reason, but these activities can go on year round. I don't want libraries to think that we only come out 1 month of the year. So if you have something that is very needed and very pressing, or you have a blank month during the summer and you are just looking for a guest speaker, please think of the MRC as a resource for you. So again, that's it. I want to open it up for questions for anybody because I know I went through a whole lot and it's kind of a heady topic to cover all of that.
If anyone has questions, feel free to unmute yourselves, and you can turn your cameras on at this point too if you would like. And if there aren't any questions, or even in addition to questions, I am curious if anybody on the call has done any programming at their libraries or hosted MRC people at their libraries. Because I know I've talked to some librarians who have, and I'm just curious if anybody has anything, suggestions to share with other people on the call. Feel free to write in the chat if you're more comfortable doing that.
Sorry. Trying to get my camera on. I had a quick question, and maybe you mentioned this and I missed it, but I know you talked about a lot of different resources that are available at the national level. Is there something more local to Vermont or to the specific areas that would have like a website where people could look for more information?
Uh, Information pertaining to what
I
specifically?
I guess that's a good question. So
Well,
maybe I'm thinking in terms of like disaster preparedness or things like that.
absolutely. And I had actually done a presentation last year, I think, through Department of Libraries, where I went through a list of informational resources that were available to librarians. And Joy or April, you may be able to chime in and let me know if that's still available to folks. But I think there were probably about 10 or 12 different websites that we had highlighted. Everything from nationally with the CDC and FEMA.gov, all the way down to Vermont Emergency Management and Vermont Department of Health, which are probably going to be your best two statewide resources. Vermont Emergency Management has what we call an all hazards approach. So they really talk about, more of the natural disasters and the cybersecurity and things like that in their focal area. Whereas if you go to Vermont Department of Health's website, we really talk about public health preparedness. So our things are going to be on infectious disease or environmental impacts of disasters, things that are a little bit more relevant to health safety. But those would be your two best statewide resources to focus on those information. But if we don't still have the recorded presentation from last year, I will look through my notes and see if I have all those lists of websites, and I can share that with Joy and April to disseminate to you.
Thank you. That would be great.
For sure.
I was not able to quickly pull up that recording, but that doesn't mean that we don't still have it. So I'll look more slowly and then get back to you, Heather.
Yeah, I know I don't have a recording on my end, but I probably still have the slide deck floating around. So
Yeah.
that at least can be made available.
Yeah, and I would have that probably too, even if I don't have the recording. So
Okay.
we can still take more questions if anyone has them. I'm going to put a an evaluation form in the chat. It would help if you could fill that out. That will help us in planning future CE. It's short. I'm going to go ahead and stop the recording since things seem to be slowing down.